Cool. All right, everyone, thank you all for being here. We have concluded our special meeting or emergency meeting, and told I should take this off. As long as everyone else has one on, I think we're okay. I'll tell you, usually when I take these off to talk to the press, I get someone who takes a picture of it right when it's off, and then it goes all over the internet as if I am walking around without a mask. So that's neither here or there. So we have concluded our emergency meeting, and the resolution did pass along with the negotiated agreement with our friends over at the county for how their public health orders concerning COVID in an attempt to stop COVID spreading will be implemented here in the city of Wichita. So I want to thank the council for indulging us this week. We were supposed to pretty much have this week off with the NLC trainings going on, or some of us are taking executive training so we can be better at this. And also, we have many folks who are either tested positive for COVID in this office or have family or friends who have. So I think some people were not here because they were taking care of themselves or others. So I do want to, again, extend my gratitude to the staff, to our city council for coming in on a day that was projected to be off, for coming in electronically for those who need to stay home, and helping us get through this. I'd also like to thank the CEO at Wesley Hospital and also the top medical doctor at Wesley Hospital for coming in and being able to take questions from the council and to allow us to get a better understanding of what our hospitals are going through, get a better understanding of what capacity actually is and what will happen if we reach even more patients. If they get to, I guess, that point where, as was described, they are putting patients in the hallways. And what would happen then? And we didn't even get to questions about, what if, God forbid, we had something major happen in Wichita? What if we had something happen that resulted in a large group of people needing immediate medical care? It is dangerous for us to be running at capacity as we currently are at both of our hospitals as it is with the current projections. God forbid, what if we had something worse? What would we do as a community? So the purpose of this, again, is because the very last metric most people look at is hospitals. You can't fake hospitalizations, right? Like, this isn't an argument of the sampling size versus the population, on a chart or a squiggly line that people who took a statistics class like to piece apart so we can have a conversation about, if we should go into more orders or not. We are literally to the point where folks have showed up at the hospital, have been admitted because they need extreme medical care, and actually had tested positive for COVID. And the entire, I think, goal of our regulations when it comes to either the city or the state or the county when it comes to addressing COVID has been flattening that curve so we don't get to the point where my mother-in-law had chest pains and needed to get admitted because she might have a heart attack. So we don't get to the point that someone in a situation like that would be denied a space, would be denied a bed. Because at that point, we're getting to what is called preventable deaths. We're getting to the point where people who normally, if they were able to get admitted to the hospital, showing up with more symptomatic issues, as those symptoms progress, they would be in a place where they could have that taken care of. If we get to where so many other communities are, where I guess access to proper medical care isn't available to everyone who needs it or may need it, then we are in a whole different level of concern as a community. Then we're at the point where folks who depend on our healthcare system might not have access to it. So again, as these numbers spike, it's not just us, it's not just Wichita, it's all over the country right now. We are in a crisis point. This isn't politics. The election's over. This is literally trying to get us to the end, which is in sight. The next few months, we will more than likely see a vaccine approved, according to the federal outlets. We will see something approved, which means we can start offering this to, not me at the city level, I think the county will with their health team, but it means that those who are in a vulnerable population, who are perishing from this, might have a really effective tool to survive, to get through this pandemic. But until now and then, we have to continue to buy time. We have to continue to protect our parents and our grandparents and our kids in the schools who have pre-existing conditions that might have hurt their immune system. We have to continue down the path that we started months ago, because in Wichita, we're not going to leave anyone behind. We care about our neighbors. This is our value. A minor inconvenience for us, like wearing a mask, inconvenience for us, like doing things a little different, will not take precedent over someone's grandparents or someone's parents or a life. We will face this head on, and we will do what it takes to protect our population. And today was the step towards the last chapter, hopefully, of COVID, which is ensuring our hospitals start to recover from what now is a very tough situation for them and for their staff, and to ensure that we march into the next year, hopefully, not only with new tools, but hopefully with less impact as far as death and grief than we would if we sat back and did nothing. So with that, again, just to get into the details, we did not, at the city level, did not implement any new restrictions at all. We just did a resolution and an agreement with the county, who also serves as the Board of Health, the County Commission, with their health team, Dr. Menz, who is the top health officer over at the county. Their current restrictions that were put in place was voted on by the County Commission. We are just allowing them to enforce that within the city of Wichita, and also through a negotiated agreement, figured out what is the best way for us to come alongside them so that we can do this in a responsible way for the taxpayers. Where if our people already have the boots on the ground, already are in seeing, I guess, maybe a bad actor who is trying to bring hundreds of people into a room without masks for the pursuit of profit, our folks can report that to the county so they can enforce the measures put in place to discourage that type of behavior, instead of having to call out someone who works for the county. We can handle that on our own, so we're not causing taxpayers to pay twice as much for something that we can handle. So with that, I'll open up to questions.
Can you explain the enforcement part? How is that going to look like?
So the enforcement part, I think, will be a lot up to the county and what they, I think, decide to do, depending, if I was to guess, on the type of complaints they get and how many complaints they get. Our job really is to take what we see in the field, what officers see, what our firefighters might see out there, and to report that to them. They can, from my understanding at this point, fine a business, or I guess really anyone out of compliance, up to $400, I believe. Or did it get shot to $500? Is it $500 now? Okay. Look around the room, like really smart people who are following this, so probably know more details on any changes. I think, yeah, so $500 would be the ticket. Now, to put this in perspective, when we had a $25 ticket for a violation of the mask ordinance, we were able to get compliance just with that. I think that it's not so much the cost, but just knowing that there is a mechanism for compliance that's important, that there's a penalty. And that does two things. One, it will hopefully, the financial losing $400 because you're putting the community at risk of a incredibly deadly disease. That's one deterrent, but also the message that this is serious, that we as a community need to take it serious, and in doing so, there's a possible fine, I think also resonates. One of the examples of this is when the city did sunset their mask ordinance, we saw the numbers shoot up. And I think part of that was more people going inside, we could predict some of this. But also I think that there are folks who believe that if we kind of took a step back, and the whole goal was to take a step back with our mask ordinance and let the mask order be in place, might have been lost on some folks. And it might have showed, well, maybe it's not that bad. Maybe if the city's kind of pulling back a little bit, maybe this isn't that bad. And I worry that message got out and allowed or caused people to lower their guard, and that might have attributed to some of the spike. Again, that's just a hypothesis. I can't back that up. But one of the goals here is to show people that this is serious. If you speed, you get a ticket, right? And that's why people don't speed. It's not because they feel that they're in danger. I could do 45 here and at 35, and I feel like I'm okay, but I don't, because I don't want one of these fine officers here, Wichita PD, to pull me over and give me a ticket. So this hopefully will entice people to know it's serious, and also that there will be a penalty if you are someone who is just in willful defiance.
And is that fee the same for businesses and people?
So I believe it will be applied more, I think the intent is to be applied more towards the type of businesses that refuse to abide by the COVID policy. When we did enforcement early on of our ordinance, there were really 3 steps to it. There was educate people of, hey, this is real, and this is what it takes to be lawful at this time. I kind of laugh at this because my world's so different. People have normal lives, right? Like, they're not following the Cedric County Twitter feed and reading the quotes from the electeds over there, or really from over here. So a lot of people might not know when an order changes, or they heard this happen and they might not know it's different this week than last week. So education is important. And then encouragement. Encouragement is we educated about, if you are a, let's say, indoor auction agency, educate about this is how to stay in compliance. Encouragement is, if you aren't in compliance and you continue to not be in compliance, you could be subject to a fine. And then, of course, at that point, you're pretty much asking to be fined. At that point, your goal is to have government action. And I think, back when we had the numbers down into single digits with our own ordinance on masks, we were able to do that with a total of 3 tickets. 3 tickets written, and that was to people who just pretty much told us, we don't care. And they were in willful defiance and had every opportunity to be lawful, and they chose not to, and thus they got a ticket. So my guess is the county, hopefully, with talking with our manager, with our administration over here, will learn from our experience and be able to apply that to their enforcement as well. And I'm really long-winded today, I don't mean to. Pilar.
Well, you talked about enforcement, and you mentioned that for your guys, it's more about what they see when they're out and about. If somebody sees something out of compliance, are they supposed to call the county then? Is there a line? What are people supposed to do? What's
funny is I think that was actually the biggest part of contention between the admins, right? Like, to me, it's like, set up a Google Voice, like, come on, this is easy, I could do this for you. But to them it was, how do we actually partner when it comes to reports of those who are out of compliance? And again, in my opinion, the goal is to educate and encourage, and usually a letter does that. Usually voicing, I guess, what should be happening. You might consider that a verbal warning, but accompanied with the information to put people in compliance, that's usually gets people on track. So my understanding is we will be setting up our number here, and we will be able to have a methodology where it flows over to the county. My hope, and that we're still working out some of these details, and the administrative side of the government, which is controlled by our city manager, sometimes pushes back on some of my ideas. But my hope is to send out a letter to anyone who's been reported to us, and that letter is, hey, just so you know, we had complaints of this and that. We want you to do well. We want you to not, obviously not have to pay a fine, not to get in trouble, don't get media attention in a negative way. Here's the ordinance. Like, it would be really, I think, effective and smart if we not only partner with the county, but also with businesses who have been reported out of compliance to try to help them get in compliance. So I think that number will lead over to the county, but there's a chance that we might be able to do something to assist our neighbors here in Wichita in presenting a healthy environment for patrons.
So there will be a hotline. Will it be anonymous?
I believe so. And I only say I believe so because I'm not sure about Cora. I'm not sure about the legalities. I can tell you I'm not going to tweet about them. I'm not going to tweet out any names, but I mean, if it's an email, like if the system.
This is where I'm coming from. We get a lot of emails from people saying, this is happening in our office place. They're not following protocols. They're not doing safety things. And we can't do anything about that, of course, because it's private business.
Right.
And none of them, of course, they're all in fear of losing their jobs, so they don't want to be public about it. Will a hotline be anonymous in that sense?
So I don't think you won't be required to leave your name, if that's what you're asking. When it comes to anonymous or not, my I guess I'm not a lawyer. I just kind of act like one at work, right? The part of my brain that thinks about Cora requests for emails. Like, so if someone shot off an email from here to the county and says this was a complaint that was delivered by so-and-so, that email might be Cora. But to make a complaint, when we enforce, and like I said, the county could come in and tell you, I'm taking an educated guess on how I think it's going to happen over there. But here, we didn't require name, address, tell us your precinct. We didn't require that to reach out and take action. So I believe that you can, if you call the hotline and you are anonymous, there's no reason to believe that your complaint would be taken any less than someone else who called and gave their full name. And and also add on there, just for I guess safety, if you do give your name, I want to be anonymous, right? Like, so add that in, and I'm sure that that would make it into whatever records, and I'm sure that if something was Cora, the press would take that into consideration. Other questions?
Now, private businesses are not under those restrictions, are they? Public
It should be.
Places where the public can access?
So a business, I believe, will be required to fall under the public health orders. I think the only exemption, and again, I would love if I had a member of the county here who could help me with this, because I'm just going from my own understanding of this, so please feel free to double check. I believe the only exemption is a church, is church services, I believe. But, a business that is in violation of the lawful order, my understanding, needs to comply. I mean, if not, we wouldn't need, I think, the county to help us, regulate or put in COVID policy for the stuff that the city owns. Like, we already have our COVID policy in place with city events to ensure safety. So yes, my understanding is that businesses will have to comply with this in order to keep their staff and their customers safe.
What agencies specifically will be responding?
So again, that's a question better for the county.
So city resources will not be involved police officers, fire will not be involved in this?
No, actually, I think they will be. I thought you meant like as far as issuing the tickets and processing. My understanding is that when it comes to reporting, the county's order allows for any code enforcement officer, and I believe that will be our police officers and also our fire department. But again, the administrative side is probably a better. Has probably thought through this a little little more than I have on the policy side, because their job is to kind of execute what we pass. So when you have that leniency of code inspectors or code enforcers, that's not referring to I guess officers. So technically, I think that there's other folks who enforce codes that could actually do this as well. So it would just be interesting we're in uncharted territory, right? Like it's kind of weird being mayor during this time. We've never experienced anything worse in Wichita's history as far as public health and really economics. So the goal is to stay agile, to allow for, I guess, changes as you implement something like this in case we find a better way to do it. So my understanding right now, it's going to be mostly officers who are out, out and about anyways, that can report bad behavior. I think our firefighters also do code inspection, so they can as well. But I think legally you can almost get into other type of inspectors too. So I just don't know if they'll pull that lever or not on the administration side.
And I know in the meeting you all talked a little bit about. It sounds like this wouldn't be officers actively going out looking for this. It would be more of a repeat offender deal.
So my understanding is the goal is to really utilize a strategy where you're going after, I guess, the worst offenders. And I've said this in meetings in the past where it's not about pulling someone over who's doing 5 miles over the speed limit and trying to give them a ticket. It's about finding the people who are trying to organize a drag race on Kellogg. Like the people who are willfully putting folks in danger, and then in doing so, putting folks in danger who are just driving by, right? Like if the thing with this virus is it's one of the most contagious viruses we know of. So it's figuring out the folks who are trying to bring people together in an unlawful way and targeting, I think, the worst. The people who would have the worst outcome, where that outcome, if you bring 200 people into a room that's 50 people, no masks, nothing, and spread COVID, all those people are going out into our community, and they're spreading it to everyone else. So it's not so much just, I think, tackling someone who doesn't forgot their mask in their car while they're pumping gas. It's making sure that you are going after the people who are willfully causing the most damage. What else we got? You got kind of which is weird because people, I can tell you're smiling, so it makes me wonder if you got another question. It's weird because she's masked for those who can't see. Any other questions?
Well, I just want to ask, in the wake of, you might have some new county restrictions coming up soon. How hard has it been to juggle the business versus health aspect of all of this and people's response?
So I think it was harder in the beginning because really you can have economic activity when you have single-digit spread, when you're down to 5%. Right now, when you got 1 in 4 people who test positive today have COVID, and those are just the people who are testing, both symptomatic and asymptomatic, it shows we have a lot of community spread. When it comes to the economics of this, there's a couple things going on. One, there's the economics of being sick or losing your job or being out of work for a long time. There's that kind of, I guess I would call it more the raw economics of that, right? Where less money, less economic activity that way. If you're a bartender and your boss doesn't have masks or forced masks and you get sick, now you step a foot into a hospital emergency room, your deductible's gone if you're lucky enough to have health insurance. If you're someone like my mom, when she was a bartender, she didn't get health insurance. If she was bartending during this year, if she caught this, went into a hospital, she'd be financially bankrupt. Absolutely. So you have kind of, I guess, the economic sense of that, right? And then you have the faith in our economy. And what I'm referring to here is masks actually helped with economic activity. The data showed that you were either more likely or very likely to travel to Wichita, to get out if there was a mask mandate. And it was because people had faith that the community was doing what they can to lower spread. It returned some power to individuals so that they could go out and go to a store and feel a little more safe. When you have uncontrolled community spread and the numbers shooting up, one of the problems is instead of going to date night, so like, all right, Friday's date night for my wife and I, we have 3 kids, we're pretty boring to be honest. Instead of going out to date night and having grandma watch the kids, we're keeping the kids away from grandma and we're ordering in. And sometimes that's just going to Dylan's and grabbing, their $5 sushi. So the economic activity doing that is much different if we went to an establishment downtown. And we're not the only ones doing that. There are a lot of people who just don't really feel safe out and about. So getting these numbers down is essential to the economy for that aspect as well. And I guess and I teach at a college and I kind of get my hat on to give lectures. The better way to put it that I think politicians have done really well is pretty much the tagline: you can't have a healthy economy without healthy people. Like if we were going to boil this all down to one line, is we can't have economic activity unless people are healthy and willing to participate in the economy. And to do that, we have to tackle COVID and stop it, particularly when it's spiking. We have to fight it because right now it's aggressive.
Sorry if I missed this. Did you say when the hotline would be set up?
I don't know, but hopefully soon, or else I'm going to give everyone Bob's number, and we'll take it from there. But hopefully soon. If not, don't worry. I'll tweet out a number for you guys to call. Because to be honest, I get the majority of stuff that I get from people who I don't know, either on Facebook or email or even text. Because when you're a state house rep, no one calls you, so it's easy to get my number out. Now when you're mayor, people call you. Is people with complaints. People who are worried that this is spreading because of bad actors. So I'm hoping that gets up as quick as possible, because calling me doesn't have the same effect as calling someone whose job it is to alert the people over at the county who can fix it. So we're hoping the number gets up quick. It might be on our side. Last I heard it was, unless some negotiation made it on the county side. Either way, that we're going to need a mechanism for people to let us know what's happening out there, or else we're not going to be able to implement our plan of education, of encouragement, and as a very last resort, some type of penalty. Guys, I can do this all day. Anything else? Should I call on you for questions like I do my students? No, just kidding. Thank you all for being here. I'm always available. Just shoot me a text or a call, and I'm happy to answer questions. It's so important that we get as much information about what's happening so people can take precautions, and particularly if you see changes in the health orders, most people want to be in compliance. They just might not know it changed. So thank you all for being here and being partners in getting this message out to your viewers, because that's going to make us all safer. So thank you.